I'm Emily Davis from Moody, Alabama. My son is Noah and he's 4 years old. I had a normal pregnancy with Noah. He was full term. We arrived at the hospital and they noticed that his heart rate was dropping, so we were rushed for an emergency C-section. They delivered Noah and he was not breathing. They did CPR for 10 minutes. He had 5 blood transfusions the morning he was born and was taken to the NICU and put on a ventilator. We were told that we would not take him home from the hospital. He improved every day. We were so thankful for the progress that Noah made, and we thought that everything would be okay. The neurologist diagnosed him with cerebral palsy, and we were devastated. But not only did he diagnose him with cerebral palsy, he told us that he would never be able to do anything and that he would not have a good quality of life and that we just needed to take him home and love him. We went for a second opinion after Noah's neurologist diagnosed him with cerebral palsy, and we saw a physician who specializes in cerebral palsy in Birmingham, but he painted a much different picture for Noah. He said that Noah's cerebral palsy would be severe from all that he was seeing, but that they were there for us from that day through Noah's adulthood life, that they had resources and therapy and support groups, and they would get us through this in Noah's lifetime to help him be the best Noah that he could be. When we saw Dr. Law, the cerebral palsy doctor in Birmingham that diagnosed Noah when he was 6 months old, we said, how can we help Noah? What is out there to give Noah the best possible chance to be the best he can be? And one of the things he told us about very briefly was a selective dorsal rhizotomy. It's a surgery that helps kids with CP. But he said, to be honest with you, Noah would have to be able to do a lot of things physically to qualify, and I don't think that Noah will be there. And a lot of other doctors and therapists agreed with them. But Marlise, our physical therapist, knew that that's something that we could work toward. And one day I said, I need you to be honest. Do you really think this is something we can attain? And she said, well, we're gonna try. And if we can't get there, that'll be up to Noah. After rhizotomy, Noah has to have physical therapy 5 days a week for 6 months, and then 3 to 4 days a week for the following 6 months. But about a week before we left for St. Louis, we got a denial letter from our primary insurance denying the additional therapy. So when I called, I spoke to someone in the medical director's office who said, even though this therapy may be warranted, it is more than your plan covers. When we got home from St. Louis, we were trying to balance physical therapy and going back to work some, and I received a phone call from United Ability, and they said, hey, we have this ATI Foundation. They are wanting to help out a couple of our kiddos, and we would like to nominate Noah. We arrived at the Barons game and we met Terry with ATI Foundation, and it was a wonderful night. Noah got to throw out the first pitch of the ball game, and then ATI Foundation was going to do their presentation, and I knew that they were going to help our family in some way toward Noah's physical therapy. When Terry presented the $5,000 check to our family for Noah, we were just blown away by the generosity of the people of the ATI Foundation to know that they would come alongside our family to make sure that Noah has the therapy that he needs after his surgery.
We are so grateful to ATI to take a huge burden off our shoulders.
I think a lot of people assume that kids with special needs automatically qualify for financial assistance, but that's not the case. We both work full-time. I'm a nurse, Joel's a student pastor. We both love our jobs, and we're middle-class Americans like most of you are. But to have a child with special needs and month to month try to pick up all the extra costs on your own for what insurance doesn't cover can be financially hard. Then we are just eternally grateful for ATI Foundation stepping up and being a huge part of Noah's story and progress.